Botox Cosmetic is the purified protein from the botulism organism. We've used it medically for over 40 years to selectively paralyze muscles that need relaxing. So in the face, we use Botox primarily in the upper portion of the face to relax frown lines, forehead lines, and crow's feet. And what we do is use usually 20 to 25 units of Botox in each area, being area 1, 2, or 3, and the injections go right into the muscle that we want to relax. So in the eye, the muscle that comes around the outer portion of the eye causes crow's feet by crinkling and contracting. So if we put Botox, usually in 3 little injections right here, it relaxes the crow's feet muscle so that you don't have the lines radiating out from the eye. The frown is a very common area to treat. People don't like to look angry or frustrated, and so we treat the muscles that cause the forehead to come together between the brow. Forehead lines swoop up. When you lift your eyebrows, it causes lines across the forehead, and so by injecting carefully into those muscles, we can relax them. When we do Botox, it's a series of small injections. You'll feel a little stick and sting for just a few minutes at the most. Afterwards, you can put makeup on, you look quite normal to go back to work. The results of the Botox take anywhere from 4 to 10 days to kick in. So what we like to do is bring you back at 2 weeks if you're a brand new Botox user, so that we can be sure that we've achieved the desired effect. Once in a while, for example, as we're treating the forehead, we want to be careful to allow the appropriate amount of eyebrow movement. So we might, for example, get a little peaking of the eyebrow. That's very easy to fix with a small touch-up. Or once in a while, someone will come back in and they have a little more of their frown movement than they expect. And so we put a little bit more product in. But 2 weeks is a good follow-up time because we're assured then that the Botox has had its full time to kick in. The next question patients ask all the time is, how long will my Botox last? And the average person in the US is treated every 4 months. We can treat you as soon as 3 months, and we have patients who really do space their treatments out farther, either because they're younger and the memory lines aren't as well established, or they're on a budget, or they prefer for some reason to space it further apart. But 4 months is the average. Botox Cosmetic is a purified protein from a bacteria. So while it does have undesired effect if we eat huge amounts, it can cause paralysis, we do know from its long medical history of use that putting small amounts right where we want it has the desired effect without the spin-off to other areas. We charge by the site for Botox, and in the US, some areas charge by site, some charge by units. When we receive the Botox, it's freeze-dried, we dilute it with normal saline, and then based on the amount of dilution, the product that we give you, the volume is based on the concentration. So we're dosing generally 20 to 25 units per site, which is quite standard, and we charge per site. Sometimes a patient will say, well, I only really want a little bit, so we do a half a site. Sometimes someone has such large active muscles, we need 1.5 sites, but that 20 units is standard. So it really works out to be about the same whether you're charging per unit or per site, because 20 to 25 units is what the average provider is delivering. We don't charge by unit, we charge by site, so when we need to touch up an area, we don't charge. If, however, you're splitting, for example, you want half into a frown, half into a forehead, we know we're not going to eliminate movement in those areas for the average adult. And so then if we need more product, we simply discuss that with the patient. Botox and surgical treatment really address very different issues. The reason we use Botox is to relax and deactivate a muscle that when it moves, it causes a line. Whether you are moving your frown muscles to cause creases, where surgically we cannot correct that. We cannot keep you from having crow's feet when you smile if these muscles contract. So with Botox, we're addressing a very different issue than what you would address surgically. When we treat you with Botox, we're using a very tiny needle, and I'm looking to avoid any visible surface blood vessels. It is still possible to have a small bruise, and while we don't like to cause bruising, sometimes it does happen. If you do get a bruise, it's going to clear with anywhere from 4 to 10 days and can almost always be covered with a cover-up makeup. Patients sometimes ask what are the side effects or possible problems with Botox. With Botox Cosmetic, allergic reactions or an undesired relaxing of muscle is extremely unusual. It is possible to relax the eyelid inadvertently, so we use special injection techniques to avoid that. Probably the most common thing that can happen is what we call a heavy brow when we're treating the forehead. So when I'm treating the forehead, I'm very careful to stay high, get to know that patient's anatomy and how their muscles move, and that might require a touch-up treatment to adjust it. But once the Botox is put in, we cannot deactivate it. It has to wear off on its own. So we tend to err on the side of caution, bring you back in 2 weeks and put more in if we need to. Botox can be used as frequently as every 3 months and as seldom as once every 5 years. So while the product's in place, it's relaxing the muscle, and when it wears off after 3 to 6 months, your muscle movement will resume normally. There's nothing at all in the literature or in the medical evidence to indicate any negative long-term effect of Botox use. Often patients will come in and they're as early as their late 20s and they're starting to see forehead lines or crow's feet or frown lines. And their question is, am I too young for Botox? The answer is no. It's very safe for them to use it medically, and they can use it medically for as long as they like. And by treating those crow's feet or lines early, they actually diminish the presence of the memory lines, because when the skin isn't being creased and folded, the skin can repair itself. So we see patients who come to us with a very deep furrow in their brow because they're always frowning. And as they use Botox consistently, the muscles are kept relaxed, the frowning motion doesn't occur, that crease softens, the skin recovers itself, and then their frown lines are completely gone. So there's definitely a preventative aspect to the aging process, in that you'll have less appearance of crow's feet, frown lines, or forehead lines in that area we're treating. It really is possible to stop on your way in from work, on your way home from work, or at lunchtime, and patients can go right back to the work or whatever responsibilities they have. Right after injection, there's a little bit of swelling and a little bit of redness. That subsides usually within 5 minutes, and you can put makeup on right away also. There are other products out there that are similar to Botox. We use the name Botox somewhat generically because it was the first neuromodulator on the market. Dysport and Xeomin are products that have come to the market afterwards. They're very similar. You could compare them to maybe Scott's and Kleenex tissues, where one name has a little more brand awareness. There is a small molecular difference between the two products. Between the 3 products, and sometimes patients will prefer one over the other for a variety of reasons. In our experience, we don't find that there's a distinct advantage of using one product over the other. However, Botox has better brand awareness and tends to be used more frequently.